I used to say there's sort of three piles of research. One is, marijuana is the devil's work. It's just evil and bad. And maybe it is in some ways, but it's not rational or scientific work. Then there's research that basically says, marijuana is like manna from heaven. And it's also faulty work. It's scientifically not done well. The study's not designed well, so you can't make sense of it. What does this really mean? And there's a smaller pile, increasingly large pile, of well-done scientific research about the effects of marijuana. But it's not just, you can't go in the store and buy a book of it, or there's no magazine. Research on marijuana, it's not there. You have to dig, and it's hard work, and it's time-consuming. And for most people, if you're not trained in research design, you might not be able to tell the difference anyway. On the other hand, the pro-marijuana research, or the pro-marijuana message, is everywhere.
Welcome to the Different Kind of Psychiatry podcast, brought to you by the ACO. I'm Dr. Chris Burrett. Each episode features a narrated article, case presentation, or interview or discussion with one or more of our doctors who practice a different kind of psychiatry. We are interested in your questions and comments, and I would love to hear your feedback. Send an email to aco@orgonomy.org. The best way to help the American College of Orgonomy spread its knowledge is by letting others know about us. If you enjoy the podcast, we'd appreciate you leaving a rating and review. If you're interested in attending one of our webinar presentations, you can meet the doctors and join in on the discussion afterwards. If you're interested in training with the ACO, you can learn more about the medical orgone therapy or social orgonomy training programs. You can connect with us and learn more at orgonomy.org. This episode features the audio from the webinar, The Legalization of Marijuana, What Parents and Teens Need to Know, presented by Dee Apple Ph.D. and hosted by Susan Marcel D.O. Listen in to hear a compelling case presentation designed to educate parents and teens about the consequences of marijuana legalization, and a discussion about marijuana's impact on the developing adolescent's brain and how it interferes with healthy emotional and social expression.
Hi, I'm Dr. Susan Marcel, and thank you for joining us today for the ACO's A Different Kind of Psychiatry case presentation webinar. I'm very happy to introduce my colleague and friend, Dr. Dee Apple, who will be presenting today The Legalization of Marijuana, What Parents and Teens Need to Know. So Dr. Apple is a licensed clinical psychologist in New Jersey. He is a member of the Board of Regents of the American College of Orgonomy and a clinical associate of the ACO. He maintains a private practice in Princeton, New Jersey, working with children, with adolescents, and with adults. He is on the faculty of the ACO's Social Orgonomy Training Program, and he's also the director of the College Core Research Group, and he's published many articles in the Journal of Orgonomy. So before we get to our discussion, I just want to let our audience know that if they have any questions, please write them in the Q&A section down at the bottom of your screen. We will get to them at the end. So, Dr. Apple, hello.
Hello, Dr. Marcel. Thanks for having me.
Yeah. So this is a big subject, and you've written and presented several times on this topic, on marijuana use and marijuana abuse. And what led you to want to present this today on this subject this time?
Maybe two or three things, Dr. Marcel. One is that I continue to work with young people. I have, opportunity to work with very many top, talented, smart, wonderful young people. And those of you who work with young people know if you work with young people, you're going to come in contact with issues around drugs, marijuana in particular these days. So it's a continuing serious issue. The other thing is that some really important things have happened since I last wrote and spoke about this. And as I pay attention to the issues around marijuana, you just can't help but notice some of these things and how impactful they are on the issue. For example, marijuana is now legalized in 24 states, 3 U.S. territories, the District of Columbia, and as of January 1st, 2021, it was possession and use of recreational marijuana is legalized in the state of New Jersey. So that's a big deal. In addition, since legalization, we've had dispensaries, and I will put that in quotes, dispensaries, since that's the word usually used for dispensing medicine. But dispensaries have been built in many of our communities. There are 3 in my hometown of Pennington, one on the path between the private and public schools and the homes in Pennington. An interesting choice of a place to build a dispensary. There's also been further development of a growing marijuana industry, now valued at $5 billion and expected to double in size in the next 4 or 5 years. If you know anything about the cigarette industry, you can't help but compare the marijuana industry to the cigarette industry, because the marijuana industry is now minimizing and misrepresenting and obscuring the test results done on marijuana, just like the cigarette industry did years ago. The industry is also funding development of new products. Back in the 70s, if you were smoking marijuana, the typical potency was 1 to 2, maybe 3% THC. Now the average THC potency in dispensaries across the country is 22%. That's the average. And with the new products that are being developed, like gummies, chewables, vape pens, you can get up to 90% THC, which is, I've said, is a little bit like comparing a half a Bud Light with 12 shots of vodka or something. It's a totally different drug. That has led into a whole new set of new medical problems that we become aware of, that I'll talk about a little bit later, and an increased danger and risk for addiction. And yes, THC is addictive. We'll talk about that as well. All these dangers are especially important for young people, because early, frequent, heavy, and sustained use by young people make them at increased risk for all of these problems. And I think we thought that with 70% of the adults in the United States, 70% of the models for teenagers now in favor of legalization, and at the same time, many young people still believing that marijuana is a plant, so therefore it's harmless, can't do anything wrong to you, that education and prevention and early intervention are really, have never been more important than they are now. So those are some of the reasons. I could go on.
Yeah, it's a lot. It's a lot what you're saying. Well, so are there any actual new research findings about the health effects of marijuana since it was legalized in New Jersey?
Yes, and what is really interesting to me is that all the research I'm going to mention today, with maybe one exception, come from research articles and studies in 2025 or even 2026. So this is all new stuff. I'm not digging up stuff from the 1800s. Okay, so the most obvious effect that we see is that should be not a surprise to anybody, but it is a concern, and it is a surprise in a way, that with legalization of recreational medical marijuana and dispensaries where people under 21 are not supposed to be able to purchase marijuana or THC products, there's been an increase of use, especially in legalized states, but also in non-legalized states, of THC products by underage minors. This is something that really surprised me, that in addition to legalizing in a state, within a state, different townships have a choice of whether they allow dispensaries to be built in their township. So Hopewell doesn't have to have dispensaries. They have to vote or have a referendum and choose to have a dispensaries, like Pennington did. So even in legalized states, if you have dispensaries in your town, the rate of use of young people go up even higher, which is, dispensaries are an issue. There are increases with use by young people of mood disorders such as depression and anxiety disorders. Also an increased risk for suicidal ideation, 1.5 times more likely. An increase in addictive behavior. As I said, marijuana is addictive, and with the higher potency marijuana projects or THC projects, addiction rates go up. The other thing I think most people are aware of is that during this very important period of development, young people's brains and nervous systems are at the height of their maturation and development. There are a lot of things happening, a lot of different systems finding their way to each other and communicating, neurons developing and connecting, all kinds of important things that have lifelong implications. But smoking marijuana or using THC can disrupt communication between these brain networks. I don't like it. It's like that, but I'm not making that up. That's a research finding. It can distort development and lead to actual structural abnormalities in specific brain regions and structures. And I've said several times, frequent heavy use, but even casual use once or twice a week of high potency THC can cause structural changes in young adults. And this is dose dependent. The more you use, the worse that is. This is another, I think, profound finding that with continued use of THC products, the pulsation of the brain, everything that's alive pulsates, expands and contracts. The pulsation of the brain is disturbed by use of THC products so that the vessels contract and stay contracted more than they were at baseline, so that over time, there's actually less blood coming to a brain of a user over time, less energy, less oxygen going to these developing systems, which is just tragic. Sort of inducing hypoxia in the brain. So we have an image I want to put up in a second. It's a SPECT scan image, and I want to just tell you what it is. It's a little shocking, and that's a good thing because it's the truth. This is not an image like an MRI or CT, which shows structural change or the structures of the brain. This is a SPECT scan is an image that shows functions such as blood flow or tissue movement in the brain. So this is an image of blood flow results. On the left, you see a healthy brain and the same person's brain on the right after chronic marijuana use. So you can see that compared to the healthy brain, there's just a lot more open space indicating areas where blood is not getting into that brain and not developing. I showed this image to one of my teenage patients who was really out of it, thinking, well, maybe this will shock him like it shocked me. And he looked at it and he basically said, well, who's to say? Maybe it just helps information get in there even better. Geez. I didn't tell you what I said to him, though.
Oh my! That picture the picture speaks 1,000 words. I mean, that is a SPECT scan shows the physiologic functioning of the brain, the connections, the neurotransmitters, all the neurons, and that I call that, when I show that picture to some of my patients, I call it a Swiss cheese brain. Like, is that the kind of brain you want? 'Cause they really struggle.
I don't know about most people, but I don't have any extra brain cells to waste, so I don't want to take a chance on that. But I want to say again, let me say this more often than I need to, but this is not an anomalous image. There are thousands of these images, thousands and thousands of these images. This is just one we picked, not any worse than some of the others. I think people get so shocked, that must be, something out of a circus or something. It's not. It's out of a research bank. So not surprisingly, with those kinds of changes, along with continued use, research shows poor cognitive and academic performance over time. Attention, memory, learning, all those things. Even IQ can go down a few points over time. We don't want that. College students who use frequently, The frequency of use predicts how frequent they are skipping class. The frequency of skipping classes predicts how low their GPAs will go, and their lower GPA predicts delayed graduation or even withdrawal from school. And the patient I'm going to talk about, the young man I talk about today, was a perfect example of that. It's exactly what happened to him. So just a couple of other things before we get to him. Use before the age of 18 is 4 to 7 times more likely to develop cannabis use disorder, a psychiatric disorder. And just, a review of like 99 studies. So it's not just a couple of things people made up. 99 studies now prove that with certain people that are vulnerable already, smoking marijuana is more likely to put them at risk for developing psychosis or even precipitate or worsening pre-existing schizophrenia. I've seen that happen a couple of times with patients, and sometimes people don't believe that because they didn't have that experience when they smoked THC, and most people don't. But if you're vulnerable, it's possible. Let me talk just a second about medical benefits, because you hear a lot about medical marijuana and the medical benefits, and they've done a lot of research about this now, and there's actually 120 studies, a review of 120 studies that shows there's actually scant evidence for helpful medical cannabis, especially for the 3 conditions that they often talk about the most, which is pain, anxiety, and insomnia. It really doesn't help beyond the placebo effect. What effect it might have should probably come from CBD that happens to be mixed in with the THC. It's not the THC, it's the CBD. So there's need more research about that. There is some evidence for some help with even THC and CBD together, such as chemotherapy-induced nausea and vomiting and severe pediatric seizures. So there is something there. 29% of the people who end up getting medical marijuana develop cannabis use disorder. So that's a problem. And sometimes frequent use causes medical problems. We're seeing evidence now of cardiovascular problems, strokes, and pulmonary disease. As in addition, something called cannabis hypermesis syndrome, which is with frequent chronic use, severe nausea, vomiting, and these people usually end up in the ER. Last but not least, driving. Everyone always says, oh, alcohol is worse, and marijuana, you just slow down and maybe you get rear-ended or something, but that's not accurate. Of course, alcohol accidents are serious. Alcohol abuse is serious. Not comparing them, but more than 40% of victims in fatal car accidents are tested had higher elevated THC levels. That's more often the case than elevated alcohol levels at this point. So THC has eclipsed alcohol. So I like to say legalization is like the magic wand that opened Pandora's box. We have a lot of new problems to deal with.
Yeah. Yeah. So this patient that you wanted to share with us about, why did he come to you, and how long have you been seeing him? Can you tell us more about him?
I'll start off by saying I really like him. He's a really good person. And I would say he's a great example of what can happen to some of our best young people in this current legalized, liberalized, confusing climate. When he came to see me, he was 18, I think. 20. He's now 29. He started smoking pot when he was 16, and his mother referred him when he was in college. No, yes, she referred him when he was in college. He started using when he was in high school, but they didn't really understand that he was using. They didn't see it clearly, and they weren't sure. And besides that, they weren't sure what to do. And he was making good enough grades anyway, so they sort of ignored it, to tell you the truth. They didn't know how to deal with it. So he graduated high school, went away to college, And when he left home, and this is a significant variable that shows up over and over in his treatment, being away from home, being alone at times, his increase of THC and drinking, his use increased significantly as soon as he went away from home. In fact, he got in trouble. He got convicted of a DUI while he was in college, which could have really been a big deal. And it did help him very temporarily because he was required to go to a 16-week drug and alcohol program at the university. And he was randomly drug tested there. And during that period, of course, he stopped. But as soon as the 16-week program was over, he returned to use again. And it just got worse from there. His performance decreased and went downhill again. Like I mentioned earlier, with increased use, he stopped going to class. He, at the very end, he did not complete most of his classes and didn't take exams in any of his classes. And his parents at that point said, we know now we have a serious marijuana problem. That's when they contacted me. I have to say, I had my doubts about whether I was going to be able to treat him. Most of my experience working with people who were at that level intensity of use were treated in an inpatient unit where I used to work in Iowa, Gordon Chemical Dependency Center, which was a 90-day program, a very intensive program. And I was very lucky to have worked there. But there wasn't anything like that around here, and he didn't want to go. And so I said, well, I like him. I assessed him closely. He was very motivated. His parents were motivated. And so I said, I'll take you as a patient under the following conditions. And if you have to meet all these conditions, one, you have to stop smoking now. I won't even work with you until you stop. I knew that was probably not going to work, but I hoped it would. And if it did, it would be a very significant sign. I said, you have to leave college, go home, and commute to college. You can't live in this. He was actually living in a dorm on the party road at the college. Worst place in the world for him. His parents had to agree to give him random drug tests, and he had to agree to take them and take that seriously. He had to see me twice a week, not once a week, and in person. I wanted him to create a Google document and write in it every day and share it with me confidentially, and I would respond to it just about every day about his feelings, what he was going through as he was withdrawing from THC, because he was going to need to talk that out. They had to agree to all those conditions, or we'd have to send him somewhere else for more intensive treatment. And it's noteworthy that with that amount of structure and parental involvement and support, he was able to stop, which was very important to me. This also occurred before legalization and the high potency THC products that were around, which become an issue later in his treatment.
Okay, so that's before 2021 in New Jersey. Yeah. So I know many therapists won't treat someone until the patient has stopped the use of drugs. I mean, how did you decide whether or not to work? How do you figure, when, like, what factors to evaluate a young person, if they're still using substances, are you going to treat them or not? I mean, I struggle with that myself with some patients. So
I struggle with it too, and it's I guess I'd say it's an issue worth struggling with. I just don't see making a mechanical blanket decision about a class of patients because they're all different. They all have different degrees of drug involvement. They all have different character structures and pre-existing levels of health. And so I want to meet them and I want to evaluate them and I want to see who they are and get a sense of how serious they are about quitting, how motivated they are to come to therapy. That spidey sense where you look in someone's eyes and you can tell they're there, they mean it, even though they're sort of stoned. They got a little bit of anxiety anyway, even still. And that's how I felt about John. So that's why I accepted him. But there have been people I will say I don't think you're ready to start treatment yet, and here's some things I think you might want to do before we meet or you meet with someone else. Um, and that's a way of testing their resolve. The other issue is that I've learned is that even while people are still smoking, depending on how much and depending on how integrated they are, therapy can help some patients begin seeing, the negative and defensive functions that the drug they're using is having on their life. They can start to see it. It might be all intellectual and not well connected emotionally for them, and it may not lead to significant change, but they start to perceive the underlying problem. Like, I just don't like doing this, or I can't stand doing that, and that's when I tend to get stoned. And when they start to make those connections, you can see something is helping. But I still believe that until they stop and are actually sober and the drug uh, moves out of their body, which can be stored for up to 3 or 4 weeks after they stop, therapy is still going to be compromised to some degree.
So how did you work with John?
I guess what I would say to start off with was part of the assessment was and understanding his drug use was, despite all these things about this kid that very impressive. He was a big swimmer, the big athlete, runner when he was doing well, plays musical instruments, sang in the choir. I mean, he's a nice kid and good parents, involved parents. There was something young about him. So it was like in certain areas of his life, he was well developed and almost sort of ahead of everyone. In other ways, he was stuck like a kid in certain ways, or at least delayed. And I actually use the phrase developmentally arrested to talk about him. And one of the areas where he was really arrested or stuck was he had a very hard time knowing how to soothe himself when he was anxious about things, which made him vulnerable to using things like THC, which dull or distract from the anxiety. And he just had a hard time getting easily overwhelmed for that reason, overwhelmed by just, age-appropriate struggles, age-appropriate challenges that all young people have to go through and master to move forward. He would really get knocked off balance by them and relapse, not necessarily using, but relapse in terms of self-care and good habits and routines that he had started to develop. Once he got sober, he started to make good progress, though. And I would say I started to make good progress working with him, because when someone is, those of you who work with people who are using, the waters are muddied. You can't see things about them as clearly. It's just sort of like you're looking at a person behind a little fog or something. And things started to clear up. He started to clear up. And I started to see more what we could do together. So we started spending a lot of time talking about the functions smoking pot or drinking had for him. What did it do for him? What did it do to him? Started talking a lot about his disrupted perceptual functioning. For instance, he really wouldn't understand things clearly. He would make excuses. He would put things off and procrastinate, be in his head, avoiding his feelings. One early manifestation of that was I would ask him a question. He would just very quickly go, I don't know. See, and I really was on him about that. What do you mean you don't know? I mean, you're not even, do you want to know? Are you trying to know? Or you just pass it off like that? Not perceiving the effects of those kinds of functioning visually, perceptually. He also became much more aware of his perfectionism, his procrastination as manifestations of his anxiety. And the biggest one of all that's come up every time where he's had trouble is He had a real hard time being alone. He could not tolerate being alone. That was one specific way where he still has problems figuring out how to occupy himself, soothe himself, put his anxiety um, down, or tolerate it at least, and find other things to do that he enjoyed, and try to make it a more pleasurable time. Very difficult time for him to do that. As he would say, everything is worse when I'm alone, and that's better, but it's been a constant thing we're dealing with.
So how do you help him deal with that?
You'll hear a little more about this, but one of the ways that has become clear is that he is living at home still. He's 29 years old. He has a very good job. He's functioning pretty well there, although when he has relapsed, and he has a couple of times in over the 7 years, he will plateau and not be making any progress and not be doing as well at work. He doesn't excel at his work the way he usually does and wants to. But he's still living at home and dependent on his parents in terms of knowing they're there in the house. And several of the times where he has relapsed, it has had to do with them going on vacation. So they'll leave for a week or two, and he's home for 2 weeks. And at first he's very excited about he's going to have the house to himself and he can do whatever he wants and eat whatever he wants. But that devolves into sitting downstairs at 2 a.m. eating potato chips and watching stupid movies, and getting completely out of the progress he's made in terms of self-regulation. When he's at his best, he can remain abstinent. He can cut back on alcohol. He gets back into exercising. And when he's exercising, he's at his best. So he's using his energy and moving that way. He gets enough sleep. He regulates his sleep. He thinks about things that are good for him and wants to be healthy. But as soon as he goes off the track and relapses with those things, he can go very quickly back to old patterns that are not effective. Although he didn't relapse in terms of using THC until 2022, after I think 4 or 5 years of not using.
Wow.
Yeah, that was a disappointment and a surprise. And of course, it happened as things happen in therapy. A lot of times he had made a lot of progress and was moving forward on certain goals that were really important to him, applying for a better job, which would make more money, have more responsibility, but he was so anxious. It took him months to write the letter to apply for that job. He was just so anxious, but he did it, and he was hired, and he did well. That caused a lot of anxiety. He had a lot of anxiety about a girlfriend. They had broken up. He had a lot of urges and longing to have a new girlfriend. He was thinking about wanting to get married and have his own family someday. And as he put it, he also started having insane anxiety about moving out of the house because he knew he really wanted to do that and he needed to do that. And then his parents took a trip and he relapsed. He didn't tell me at first, the first time he did that. He felt ashamed. And I believe him when he said he really wanted to stop on his own. He really wanted to show that he could be independent, but he couldn't on his own. And with help in therapy and with his parents returning, he was able to stop that time. So, and then I think we had 3 more years of no use. And then he had another relapse under similar conditions where he was doing very well. Things were moving forward. He was starting to look at houses. He was starting to look at and interested in a girl. All this progress was happening, and he was feeling more anxious. And I guess I could say I wish I had seen it more clearly myself that we're moving towards another possible crisis. But he did slip back in fall of 2025. 6 months ago or so. And this time he told me immediately, and he had a little bit more anxiety about it. And there were some things like his previous relapse, such as he had been making significant progress and was getting anxious about his own goals and getting closer to moving out. But some things were different too, one of which was the legalization and the availability of high potency THC, which he had started using. There's a dispensary about 2 blocks from his house. All he has to do is, if he gets anxious, he can walk up the road and buy THC and start using, and that's what happened. And I think that might have scared him a little bit.
What I'm hearing is over all these years you've treated him, there was this learning process you were going through and that he was going through, and him learning about his fear of being alone and being anxious and setting goals and yet what strikes me is he keeps getting back up. He falls down, but he gets back up, which, you don't always know that about a patient when they first come to therapy. Do they have that ability to get back up and try again? And you clearly have built a connection with him to allow that to happen.
That's one of those things that I mentioned earlier about him that I really like. The anguish. I mean, he is, it's not like he's a sneaky little guy, running around smoking all the time, not telling me. He really wants to stay sober. And that's what's kind of scary about this to me. He wants to stay sober. His anxiety is so strong that it overwhelms his better intentions, especially given that like I said, this is an area of development he's stuck at. He's not strong in terms of dealing with his anxiety, and that's something we need to continue working on. I've even talked to him about medication consultation. He tried it one time early in treatment, didn't like the way it felt at all, and went off in a month or so. And at this point is just not interested in doing that. He says, I will stop this eventually. I have to. But he's got some work to do.
Yeah. So I guess I'm wondering, like, what kind of therapy is this that you are providing for him? How is that different from another therapist's approach?
I call it character analytically informed psychotherapy. It's a relationship, a trusting relationship based therapy, talk therapy. Although we do talk a lot about his energy and needing to move his energy. I do talk to him about the clarity of his eyes. Sometimes we'll have him follow my fingers and clear his eyes up so that he can see and think more clearly. We're spending a lot of time, again, talking about the functions of THC and other things he does that are defensive, that take him out of contact with the feelings he needs to feel to get better, even though they're painful and frightening to him. Like other kinds of therapy, like CBD, which I don't do specifically, but I do use some of the techniques, paying attention to the thoughts he has that are always related to his anxiety. So he'll have irrational thoughts that really create anxiety for him, and he's not even aware that he's thinking that. It's like it's a tape running in the back of his mind. So I have him, when he gets anxious about things, I'll have him spend time noticing what is he thinking, and that's something he continues to use the Google Documents to record things like that, because there are things that he might remember in the moment but forget by the time our session happens. So that's a basic thing. I mean, the overall goal is for him to be in stronger emotional contact with himself, not just intellectual. He can be very intellectual, and he's very interesting. So it's easy to get off the mark with him if you don't watch out. If I don't watch out, he can be very not entertaining, but interesting to listen to and realize we're talking about something incredibly powerful and sad, and he's sitting there like it's no big deal. And that's when I will try to make contact with his emotions. Like, well, what are you feeling right now? Are you feeling anything? Or point out something about the way he looks, his eyes. But I see sadness in your eyes. Do you feel that? And trying to help him be more aware of his feelings about things, especially his anxiety. I want him to feel his anxiety in the room with me so we can deal with it. not just avoid it until it runs over him at home and he acts out like he has a few times.
Yeah. So you're connecting how he thinks, how he feels, and then what's going on in his body.
Yes, more and more of that. And the thing that's, I guess I would say, frightening and I respect in a funny way is the power of these drugs. I mean, once you start taking them, you can't think clearly. You can't see what it's doing to you. It changes your consciousness, and so it changes your self-consciousness and therefore your self-perception, and you just can't see what it's doing to you. It's a unique drug that way. And in some ways more dangerous than other drugs because of that, not to diminish them for it's in danger of other drugs, but people can't see that it's hurting them.
Yeah. Why do you think that they can't see? What keeps people from, with all this research and knowledge, how come people may not be able to see or take this effect so seriously?
Well, I can answer that sort of two different ways. For John, his ability to tolerate anxiety is still so far behind his other abilities. He's really not, that's a weakness of his. He's very easily overwhelmed by his anxiety. So, and he has learned from his experience that THC will take care of that for him. He knows that, and it's right there up the street in even stronger forms than before. So if he gets overwhelmed, if you've ever had intense anxiety, it's like not having oxygen. You'll do pretty much anything to get it. It's like, it always reminds me of things you hear about people drowning. They will literally crawl up on top of other people to stay above the water. And when people get that anxious, they will do things they wouldn't necessarily do otherwise. And going back to using THC is one of those things. So, that's improving with him. And we're now working on his most recent relapse. I'll tell you a little bit about that in a minute. For other people let's say people who don't use, why can't they see this? It's a complicated question. I mean, it's hard to find this research. There's a lot of research out there. I used to say there's sort of three piles of research. One is, marijuana is the devil's work. It's just evil and bad. And maybe it is in some ways, but it's not rational or scientific work. Then there's research that basically says, oh, marijuana is like manna from heaven. And it's also faulty work. Or it's scientifically not done well. The study's not designed well. So you can't make sense of it. What does this really mean? And there's a smaller pile, increasingly large pile of well-done scientific research about the effects of marijuana. But it's not just, you can't go in the store and buy a book of it, or there's no magazine. Research on marijuana, it's not there. You have to dig, and it's hard work, and it's time-consuming. And for most people, if you're not trained in research design, you might not be able to tell the difference anyway. On the other hand, the pro-marijuana research or the pro-marijuana message is everywhere. My wife and I were watching a movie the other night. It was a nice movie, good movie. Several big-time actresses and actresses in it. And right smack in the middle of this movie, which is already interesting, there's a scene where the three of them are in the bathroom and they smoke pot. They're grown, adults. And it's like they're sneaking and they're being naughty and it's funny. And I'm going, that's an advertisement for marijuana. Why are they doing that? Why is that there? But they're in lots of movies, lots of songs, lots of magazines, lots of dispensaries that you walk by when you go to your bank or your Burger King. So it's all over. That stuff's all over. The facts about marijuana are lost in a blizzard of distorted facts on media. So it's hard, and that's scary. And I think if you want to approach the conspiracy theory level of things, I think there's some intent on the part of the marijuana industry to put out a lot of misguided facts, misleading research about marijuana, just like the cigarette industry did years ago.
Right, big tobacco back in the 30s and 40s, and then now this is, big marijuana. It's a business, and it's costing people their lives. I see it in adults and in college age students, some high school students. I've seen many who have been permanently damaged. Their brain just is not going to be the same because of their exposure to marijuana. And it's like they got hit in the head with a 2x4, or they had a stroke or something. It's functionally very similar, that they lose core function. And it's sad. And that's the reason for this webinar and this discussion is, create a place where we can talk about this and see if people will listen. And your patient, John, is very lucky to have worked with you and is working with you all these years. So good for him.
Let me say another thing or two about John, where we are now. Like I said, when he relapsed most recently, he came to me immediately. As before, the first time he relapsed, he didn't. He hid it for about 3 weeks because of his shame and his wish to get out of it himself. But he knew he couldn't, so he came right away. He still did not want me to tell his parents. And it was a tricky situation because he's living with his parents, but he's an adult, and I don't have a right to tell them if he doesn't want me to. So I was in a difficult situation where I didn't want to just be, if we weren't making progress towards his stopping, I even said to him, I'm feeling guilty charging your parents money for this. I'm not happy with that, and I think we're going to have to figure out a way for you to stop on your own and prove to yourself that you can do that, or we're going to have to consider involving your parents again. And he agreed, that's true. So for 3 weeks, I set up tests or challenges for him. Could you do this? Would you try to do this? Cut down to once a day. Stop for 3 days. If you're going to use, stop for 3 days and then smoke 1 day. Whatever, just to slow it down. He couldn't do any of those things. And he would come back week after week. How'd it go this week? Not too good. And he would feel shame and disappointment. And I said, do you see where we are now? And he said, yes, I do. I said, do you want me to call them or do you want to call them? He said, I'll call them. And I've been meeting with them the last 3 weeks. So that's going to help. I think that's going to help. But he hasn't stopped yet, so it's difficult. And I personally think he's now addicted to it, unlike previous times where he was just dependent on it. I think he's now dependent and addicted. That's the way I understand it. It seems different to me.
Mm-hmm. Great. Well, we have a bunch of questions in our Q&A, but is there anything else you want to say before we answer our audience's questions?
I do like just a summary. I'd like to say, because there's so many details and it's a bit overwhelming to understand all these details. But the main message that I want to say, and I know my colleague Dr. Marcel wants to say as well, is that marijuana is not harmless. It just isn't harmless. It can be addictive. It certainly can be something people depend on emotionally and retard or slow down their own emotional development, which is what young people need to be doing. That's their business. And the harm is serious. It's not just a little nothing thing. It's a serious thing. And it's much more harmful the younger people are when they start, and people are now starting at 14. The more they use, the more often they use. And I see kids who use every week, more than once or twice a week. The more sustained it is, so how long they use it, and the stronger the potency of the stuff they're using, which they can get now up to 90% THC potency vape pods, which they're not supposed to be able to get because you're supposed to be 21. But I'm more than ever against legalization. So I'm sorry that it was legalized. I think it's done a lot of damage to our communities and our country, and our young people. And as I said before, as a summary statement, shockingly to me, 70% of adults in America now are in favor of legalization. And I would say, you could say, well, what are 70% of the people stupid or something? I don't think that's it. I think the marijuana industry has done an incredible job advertising and bringing this about. First by punching through medical marijuana, which was, a farce in a way. They really just did that to legalize recreational marijuana and advertising it as a harmless, light, just like they do with cigarettes, low tar, light cigarettes. It's all for appearance. So I just want parents to really, and teens, maybe teens especially, to take it serious. Just because the other kids are doing it doesn't mean it's okay.
Yeah, well said. Well said. All right, so you ready for some questions?
Oh, yes. Thank you.
Yeah, they're pretty varied. So, question about dispensaries. Are there legal regulations affecting the marijuana THC content, distribution, and use?
Great. It's a great question. There should be in every state that's legalized it. If you're going to legalize it, at least set up some kind of regulations about the THC potency and those kinds of regulations to control it. And in some states, a minimum of states that have legalized that do this, but in some states they do have those kinds of limits on things, which is better than nothing. I would say better than nothing. But if you think 90% THC, that's bad, let's regulate it. Nothing over 50%, that's still horrible. So the only safe marijuana is no marijuana. That sounds so rigid, I know, but I think it's true.
Well, can I share a story? I think I
Please,
mentioned this to you. When my children were in elementary school, like 7th, 8th grade, we had a police officer come into the school with the kids and the parents. And it was a drug awareness lecture, if you will, and a slideshow and discussion. And the officer, she said what she said, and then she wheeled in a gurney that the emergency room or the ambulance would use to take someone to the ER. She wheeled it in, and on top of the gurney was a body bag. And she sat it right in the middle of the auditorium, and it was absolutely silent. And she slowly unzipped it. And there was a slideshow going on at the time, and she was showing what a crack house looked like, and the various instruments that people use to get high, and injuries that they sustained in a car accident. So she's unzipping the body bag, and in it she opens it up, and all the kids were looking. We were looking. It was one of the most dramatic moments. And I believe that officer probably saved many of the children's lives, because it showed them the reality of what drug overdose and addiction and dependence can do. It wasn't specifically about marijuana, but it was about all drugs, and including marijuana. And I mean, I've seen that in the emergency room, people coming in with drug overdoses or psychosis, and some of them are not going to get better. They're going to just get stable, but at a much lower function. So, that's so dramatic that how do we help people see, and how do we regulate this, with these dispensaries? I don't know. I think programs like that, and, I'd be willing to go to a school and talk with people and students and parents about that. If anybody listening is interested in that, we could help them develop.
The thing you're saying that I think is really important is that you have to reach people emotionally for them to get it. You can talk about it intellectually and give the facts, and that's important too. But if they don't feel anything, if they don't have any fear about this,
right.
and we should have some fear about this. The question before about the regulating and the different levels of potency and stuff, and I'm sort of I'm serious when it's only good marijuana is no marijuana. But one of the things that's difficult about marijuana that doesn't scare people is because you can't see what's going on, is that kids function anyway. They're going to school, they're doing their homework, they care about college, they want to get in, they're still making B minuses or B pluses or A minuses on their tests. They're doing okay. But the question is, how much better would they be doing if they were more clear-minded and not using THC? How much better would they be? So there's this opportunity cost. People, unless somebody's really being affected, you might not even see what it's doing to them. And kids will throw that in your face, Oh, I have a friend who's got a Porsche, or I got a friend whose dad is a CEO or something, and all these, and he smokes marijuana.
Well, there's a question actually in the Q&A. What can a young person do if the parents are using gummies and vaping? How does a young person deal with that?
I can't say what I really think, but the research about that is in 2025 is after legalization. Again, here we go. After legalization, parents who were researched and willing to admit it, so I think this is an underestimate, went from 5.7% admitted. This is a group not only using THC, but using THC with their kids. Okay. So there's a much bigger number of people using and trying to hide it from their kids, which they don't do a very good job doing. Kids are smart. They know where it is. I had one kid who his mom got mad at him because he stole marijuana from her stash. So she was kind of in an awkward position. But it went after legalization, people using marijuana with their kids to 8.4%. So that's a lot of people using marijuana with their kids. I would say to any kid whose parents are using, or even seeing if you're interested, I would just think to myself, I'm going to be smarter than my parents are being right now. And that occasionally happens. Save yourself, save your brain. And if you want to talk to somebody about it, you can reach Dr. Marcel or I about it. But that's a very, very difficult situation, but not an unusual, unfortunately.
So there's a question, kind of a segue. Someone wrote, "Great case and presentation. Thank you. Another aspect of John's recovery was the family. How do you assess the family when deciding to take John on? And how do you decide the treatment plan and pack an agreement? And in light of if the parents are also using drugs and alcohol, how do you do that assessment?"
These parents were not using drugs or marijuana. Most parents do have alcohol, and then you have to assess, well, at what rate and what's the function of their use of alcohol and what are they modeling for their kids. I have a good friend whose husband, my wife and I invited them over for dinner. I knew they were struggling with one of their kids with marijuana, and missed them and wanted to just see them in that context. And on the phone, I said, what do you guys want to drink? And they said, we don't drink. I knew they did before, nothing hard, beer, but they quit drinking. And they quit drinking as a support to their kids' treatment, trying to stop using marijuana. I loved them for that. That's very admirable. I told that story to John's parents just a couple of weeks ago, that I'm not telling you have to stop drinking, but this is what some people might do, and you have to consider the effect on it, because they do drink. And last Christmas, John was the cocktail mixer for the party. So that's a part of the family structure. So they need to look at that. Thank God they're not smoking, or they wouldn't even be able to see it, that they're doing it. I hope that answers
So
it.
there's a question also. Yeah. Oh, yeah. But kind of, again, a segue off that. How do young people deal with peer pressure? But if they're also getting pressure from their peers, and then also they go home to it, how does a young person, how do you, as a therapist, how do you help a person in that situation with peer pressure about pot and alcohol?
Well, I mean, the easy answer is you talk about it and you bring it out of the open. And I basically say, It's really tough. You have to pick your friends very wisely. Having less true and healthy friends is much better than having a lot of unhealthy friends. If and I kids get caught up in this popularity thing, this social competitiveness. A lot of times I'll ask kids, so you have friends, right? Yeah, oh yeah. How many? Oh, like 50. I don't say it, but I say there's no way you could have 50 friends. There's no time in the day for that. And I try to communicate a healthier standard that's relieving to them a lot of times. If you have two or three really good friends, you're doing very well. That's great. Oh, well, I have a couple of good friends. Well, that's great. Stick to them. Watch out for these other people who want to be friends but aren't really your friends. So sometimes I'll practice with them refusal skills, like how to say no directly or how to say no indirectly if they can't do that. Oh, thanks. I can't. I got to go. I got band practice or I've got other plans, and just put them off. I've even had kids say, could you um, drug test me so I can tell my friends I'm being drug tested and can't use? That's a new wrinkle. I said, sure, well, I don't have to drug test you, but you can tell them you're being drug tested if you want to, and kids have done that. So it goes back to the parents a lot. Of course, if the parents are using, it's a really a difficult situation. But parents need to be talking early and often about these kinds of issues, about all kinds of issues with their kids. You can't start talking to them when the problem comes up. You can't wait for trouble. It has to start early. Um, and honest, non-judgmental, not angry discussions around the dinner table about drugs and do you have any friends you're worried about? And they always have friends they're worried about. And I know you love her. I mean, that must be so hard for you to see your friend. My oldest daughter, I remember talking to her best friend, she was very worried she was starting to use drugs and that she was going to lose her. It worked out. She didn't, but those kinds of conversations are very important. Um, I also say it's very important for parents to not focus on being friendly or be the friend of your kid. They only have two parents, if they're lucky. They can have other friends, but they can only have a couple of parents. And our job as parents is to set clear standards and stick to them with consequences.
No, that's a very, very good point, Dr. Apple. That's brilliant. Yeah. There is a couple more questions if we could get to them before we wrap up. Somebody's asking, does research support claims of cancer-related pain control?
Yes, but let me make this really clear.
There's always a but.
When you're talking about teenagers, there often is but I'm just laughing because I had a very, very smart college student who was using THC, and we were talking about it, and he was getting a little defensive, and he said, well, how can it be bad for you? Doctors use it. Doctors say it's okay, and doctors use it to cure cancer. And I said, no, I don't think so. He said, yeah, they use it to shrink tumors and cure cancer. And I told him, I said, look, there's a lot going on. I may not know about this, but if you can bring me the article showing me that, I'll give you $50. And I never saw it, of course. I'm not perfectly clear about this because a lot of the tinctures that you get in a dispensary or even from a medical source will have a small amount of THC in it, even though it's primarily CBD. And some people say that having a little bit of THC that isn't psychoactive somehow helps the CBD to be more effective. I don't know for sure about that, but that seems to be true. But CBD, even with a little teeny bit of THC, if you can't get 100%, can be more effective for chemotherapy-induced nausea. But there are other drugs out there that are specifically designed to address nausea. I'm not always sure why people prefer the THC or the cannabinol sources over these other drugs, but people do tend to go that way. It never made sense. There's never a reason to smoke marijuana for medical reasons. But there are other things you can take now that don't involve smoking.
Yep. Yeah. So a couple more questions. You up for them? Yeah. So this is about John. Does he pay or contribute for his therapy? And does he contribute any money to his parents for living with them? So interesting.
Great questions.
Yeah.
Those are great questions. Then the answer is yes, yes. But it didn't come easy. And it shows how much he's grown up, that the first time I brought up that he should, let's consider his contributing to his rent, he was really defensive and incensed that that's just not fair. Why should I have to do that? I'm just 26 years old, and, he'd rather save his money so he can get his own apartment. And meanwhile, his parents were retired. But he came around, and he's, now much more aware of their feelings, and actually anxious about losing them someday. So he's much more tender and sensitive about them, not always for the most rational reasons. He is also paying for part of his therapy now.
Mm-hmm.
I think more skin in the game that way.
So another question, short of relapsing, how does John exhibit that he's not tolerating his anxiety now?
Oh, good question. How does he show that he's not tolerating his anxiety? There are a lot of other, one of his earliest relapses where he didn't relapse to using marijuana, but relapse in terms of giving up all these really healthy routines and patterns that he had been developing. That's the surest sign that he's having a hard time with his anxiety. He'll just sort of give up and collapse and quit exercising and go out and buy a bunch of junk food and stay up late and not get enough sleep and stop working on his work that he needs to work on and just cruise for a while. So that's a sure sign.
Yeah. Yeah.
And he might drink more beer.
Mm-hmm. There's another question. What was in the body bag? And what the officer pulled out of the body bag was all the various instruments and things that people use to get high. And she was teaching them about, how to notice, oh, that's a drug paraphernalia thing. And she had a death certificate in there. And then up on the screen was a video or a slide of somebody who had just died of a drug overdose. So it was not an empty body bag to answer that question. Okay, I think we have one more question. It's a comment. My client, a lawyer, successfully quit using alcohol but replaced it with marijuana. He thinks he is functioning just fine, much better than when he was drinking, but he will not acknowledge that it's an issue.
There's even research, or at least articles out there. I'm suspicious of the source. I'm wondering sometimes if the marijuana industry or some associate isn't putting them out there based on their wishful opinions about things. That someone just the other day, the title was THC may help people drink less. I think it's possible that THC may help some people drink less. I mean, that may be true. Whether that's a good thing or not, maybe they should think about why they're drinking more, and maybe they should think about why they need to use THC to quit. It does bring up another issue, which is this attorney guy is probably functioning adequately in his job. But there's something, and I forget the name of it. It's not opportunity cost, but it's the sort of measure, so to speak, of how much less well you're doing or how much less accomplished you are, how far away from your true potential you are if you are depending on substances like alcohol too much or marijuana. And marijuana does, like I said, if you smoke marijuana, you are getting less oxygen in your brain. There's no way that doesn't impact your thinking and your performance, your ability to see, and your ability to feel. So you may be able to function, especially if you're already a smart person and well developed, but it's going to knock it down some percentage from what your potential is. We spend so much money sending kids to camp and trying to get them educated and buying all kinds of tutor time and getting them into college just to bump them up 5%. Why knock down 10%, letting them smoke marijuana? I don't think that's a good idea.
Yeah. Well, we are going to have to wrap up, but before we do, is there anything else you would like to leave our audience with before we close?
I would like to say one thing, not specifically to the audience, but I want to make the audience aware of how much I appreciate the support from the American College of Orgonomy, specifically Debbie Barnett, Rebecca Wildick, and Chris King for their administrative and technical support, which we couldn't do this without, and also how much I appreciate Dr. Marcel being here today with me. It's a pleasure.
Yeah, it really is. And there's so much to this based on all the questions. And I would love to have you come back and we do this again and invite others to come. And I hope everybody that's here listening, if they'll bring, when we do another one, bring a friend or a family member or your kids.
I did want to say, too, that we've talked about this, that because teenagers that are using and then in addition are required to go to these talks, you don't have much luck getting through to them. And so we've been thinking more that maybe if we can find ways to encourage groups of people, young people who are genuinely interested, maybe they're younger, maybe they're not yet enamored or under the influence of THC, to talk about some of these issues with other peers or with their parents, that would be a really, I think, effective way to do prevention work. And coming to your schools, coming to your places of worship, private homes who want to host a talk discussion, things like that. We're really interested in figuring out ways to interact with people that way. So I appreciate everyone taking the time on a Saturday to come to this event.
Yeah, this has been very wonderful and eye-opening for me. Even all the years I've been in practice, I learned a lot in our discussion and just reading what you've shared. And so I want to thank you, Dr. Apple, for all the work and time and your experience that you're sharing with everybody today. It's profound and very moving and important. And if we help one kid, then it's worth it, in my mind. So thank you.
Thank you.
In wrapping up, a special thank you to the donors of the ACO who make this work possible. I hope you'll check out our Journal of Orgonomy on Substack.
How do you feel after listening to this presentation and patient story? What do you think? I feel optimistic that more parents, teachers, and teens are starting to see the truth about the impact of marijuana on users, and especially users who are teenagers and young adults. Dr. Apple gave a presentation in 2020, and Dr. Ed Chaska gave a presentation in 2022 about patients struggling with the impact of marijuana use, and they're worth listening to if you'd like to hear more. Links to those podcasts will be in the show notes. If you're interested in having an ACO doctor speak to your school, parenting group, or other organization, reach out and let us know. The best way to help the ACO spread its knowledge is by letting others know about us. I hope you share this podcast with your friends and family and let them know about our work. You can connect with us at orgonomy.org. I'm Dr. Chris Burritt. Thank you for listening to the Different Kind of Psychiatry podcast, brought to you by the ACO. Since 1968, the psychiatrists affiliated with the American College of Orgonomy have been helping patients discover greater satisfaction, health, and overall well-being in their lives, whether patients suffer with mental illness, struggle with addiction, or feel unsatisfied with their work lives or relationships. Medical orgone therapy, as practiced by the physicians at the ACO, offers a way forward, often without the use of medication.